typical and comorbid conditions, but pulled in the CEO of the National Organization for Fetal Alcohol Spectrum Disorders in Australia. So I've put her name on this. And what I'm basically going to do is just, how many people work with fetal alcohol? Oh, good, good. Alrighty. And so I'll just give a little background about it and how I bumped into it as a community issue, and some of the strategies that are known, but also some of the puzzles. And I have to back up what other folks are saying about, we know a lot about things, but not a whole lot about the efficacy of certain treatments. It's kind of sketchy, particularly in the indigenous populations. We have fetal alcohol syndrome disorders, and that's considered the umbrella for a wide range of other things, including partial and neurodevelopmental alcohol exposed. And it's caused by ingestion of alcohol during pregnancy. It can lead to some very serious and damaging effects, but it's completely preventable. This is one of her slides. Now, again, the statistics are really interesting, 1 in 1,000, but then for alcohol-related neurodevelopmental disorders, 1 in 100, and I've seen some figures I'll show you in a minute that are even more stunning. What do these people have in common? Any ideas? All children are exposed in pregnancy to alcohol. And if you just Google it, it's amazing how many folks we know. The effects of alcohol are a bit related to what stage of the embryo is the ingestion occurring and at what amounts. So here's just the continuum of effects and how it might interact with the developing fetus. The distinctive characteristics that you would know about are the facial, low birth weight, prematurity, microcephaly. Facial features can dissipate over time, but the brain damage symptoms can show up in growth, developmental, and behavioral problems. Here's some of the classic features. Major considerations is the dose-time relationship across gestation. No known safe amount of alcohol is okay, although you'll hear some dispute in the literature about a little bit here and there is okay, but the common view is don't have anything. Often regarded as invisible, and there's multiple systems implications. IQ is not necessarily the reliable disability range indicator, and everybody living with FASD is different, and lifetime impact of the condition. And the parent who uses alcohol, we generally don't talk too much about the paternal use, but here's some of the implications for the involvement of the man, or the father. Low birth weight, impaired cognitive skills, changes in behaviors of sons of alcoholic fathers, low sperm count, lower rates of pregnancy, decreased sperm activity, and the effects on epigenetics. It's not completely doom and gloom, although it's very sad to me, the extent of difficulties people have that could be preventable, but here's some ideas that there can have some folks with creative outputs or creative possibilities. And this is some figures I found interesting. They're saying school children, the 5% is coming from a population in Italy, and 2% the U.S., 5 to 7% overall. And those figures seem, I don't know how they ring with you, but they might seem a bit high. But again, it's really hard to determine and estimate. Get some 60 million people in prison have these defects and disabilities. The costs in education services alone are about $5 billion per year. Lifetime cost, and it's estimated the care to be $2 million per person. These are big numbers. and the estimated for partial is not known. Australia has among the highest alcohol consumption in the world, although I just read something within the last 24 hours that South Africa seems to have the highest alcohol consumption of pregnant women. Between 50 to 60% of Australian women report using alcohol during pregnancy. Indigenous Australian women are less likely to drink during pregnancy, so, but when they do, they are at higher risk rates. I'm very interested to get some feedback on this. Do people know much about the enforcement of alcohol use in women and being put in jail or committed? Does anyone know about that? Is it enforced? But apparently 5 U.S. states, and here's where they are, and it's considered to be part of child abuse, and a reportable thing that health professionals are supposed to do is report people who are putting their children at risk in their fetuses. Any comments on that from anybody? I'm not aware of that in Australia, but apparently in the U.S. I also know that places like England are thinking about if you allow your kid to become obese, you're up for child abuse charges. Insurance companies won't cover you if you're involved in behaviors that are costly medical conditions or lead to that. So those are some considerations. Okay, prevention strategies. These are some of the typical things you hear about supplying the supply and demand, reducing strategies such as the price, restrict trading hours, selling dry communities, and the enforcement of laws, the demand reduction by early intervention and activities and treatment, and the harm reduction strategy. So these are kind of typical for a wide range of substance use issues, but particularly for pregnant women. Warning women of the danger of alcohol during pregnancy has been proven of little value, but I do have some studies, and I think it really has to do with how you approach people on this. These next two items are what drove my involvement, is approaches that include broader determinants of health, including overall health, nutrition, violence, trauma, sexual and reproductive health services, and prenatal care. And that's the approach we use in our student-led clinic that I'll discuss in a couple of minutes. And then the community-driven approach. I tend to view that community action and that involvement works best in my world. Public education, professional training, and screening. I'm finding that too few people even ask about do you use alcohol and how much, and actually don't ask things like what are your preferences, rather than people are afraid to admit if they're fear of incarceration or being put into treatment. So rather than do you or don't you with a yes or no, just using the open-ended clinical statement questions about, so what do you do at gatherings, and how do you celebrate, those kind of things. Public policy, warning labels, programs and services, and parent-citizen activation. So what's known as, these are pretty common sense, building empathy, getting some right questions to ask people that don't put them off, and identifying people at risk without stigma. This is old data, but it's basically reinforcing what I've just said, providing empathetic interventions, motivational interviewing, and the sort of things that have been discussed already today. In Australia, we've got a few initiatives, but unfortunately, the outcomes are not necessarily clear. So we do know that restricting alcohol and its availability leads to reduced drinking, but what impact it has on fetal alcohol syndrome is unknown. So we do know some of these things work, but haven't been evaluated directly with pregnant women. And I just said that. Heavy drinkers, like I said, will avoid professionals, fear of getting governmental interference, and underdiagnosis. So those are some of the puzzles and clinical issues of identification. Didn't I just say this? Yeah, build empathy, routine screening pattern. I actually do find that we don't ask clinically enough about a range of things, including domestic violence or alcohol use, gambling, you know, a whole range of things that just should be routine. Anxiety and depression. I have a hard time getting students to ask people about those things. I think there's part of a different assessment, and I'm going, no, it's the everydayness and the comorbidities and should be just part of everything you do, and ask people how they're going. You ask all those things. This was a study from Russia, and it was, and again, this bears out just what we would consider, I'd consider common sense, to obtain women's perceptions of their use of alcohol during pregnancy, and basically it was interviewing to find out what kind of messages women would hear. And again, I think it's just basically stunning that, and I find this in my clinical practice, that women really are not aware that drinking alcohol during pregnancy, that there's some connection to the developing fetus. And even after having the child, they think they can resume drinking and there's no passage of that to the baby. And to me, it's just a basic public awareness campaign that professionals aren't engaged in, and we don't have it as part of our everyday awareness. So the women found that the best sorts of messages were at least getting that information to them, and that their information coming from an OBGYN would be useful, and that doesn't typically occur. And husbands and partners should be on board. They definitely are another layer of folks that aren't necessarily aware. And that believing the research data coming from physicians is generally accepted. Okay, and conclusion, we need to take a broad approach. And again, it's public awareness, everydayness of getting folks to really think about it, more than just warning labels. Here's another one, and this I'll just about conclude it after this, that there was a public awareness strategy about what kinds of messages would help people abstain. And they gave some computer-based scenarios, and there was 4 conditions. One was giving folks, women, a story that was threatening, one that was self-efficacy with some threat, and another that was plain self-efficacy statements, and another one was a control group. And interestingly, they found the threat as being the most powerful message to give. Now, when you look at what the threat was basically saying, if you use alcohol while you're pregnant, we cannot guarantee that you're not going to have some birth problems and baby issues, deformities, and have an effect on the fetus. So to me, that wasn't a threat. That's just some basic information, but it was interpreted to be threatening and therefore paid attention to. Okay, this is my little clinic in one of the top 5 places in Australia that has, it's underserved, high violence, high crime, all kinds of things. Actually, since I've been coming here the last 3 years, the violence has gone down. The students are doing a great job, and people are very protective of what we're doing. So it's a student-run, integrated health approach that we use, so anyone that pops in gets whatever they want or need in terms of health and wellness care. So it could be nutrition, it could be try to get a job, all kinds of things, prenatal screening. So we ask routinely about the whole range of what's going on in your life and what do you want different. I work with 24 different agencies it's becoming a little vibrant place of one-stop shop. These are a number of the activities that go on there. And this was the funding we had when I wrote this, trying to get, was empowering young moms. So we decided if we got the community themselves to take charge of their own health needs and community needs for their children, that we could start spreading the word in a greater way about fetal alcohol. And so this idea of empowering young moms was to build their skills and their self-confidence, get them in the idea of getting some employment and resilience and risk to health, particularly fetal alcohol. We were putting moms in the center of everything to come up with their own daily schedule and plan around nutrition and development and knowledge to respond to their needs and support. So it's teaching cooking, getting a food bank going, talking about prenatal immunizations and the sort of things that, rather than going to a professional, coming to their own self-help network. The food bank, doing some cooking right there on site. Anyhow, we didn't get funded particularly for employing the residents, the young women, but we have this approach going with our drop-in center anyhow. So we have kind of a community kitchen, an area where the students and everybody else hangs out, and this information is getting imparted. So we're doing it kind of ad hoc, but it's part of a larger system of nutrition, and we have worming days and scaby days and lice days and feeding in the community garden and birth certificates. So it's part of a bigger package, but that's kind of the approach we're taking. And I will conclude there with some references and thank my friend that really knows about this topic nationally in Australia, and I'll invite some questions. Thank you.